You're listening to Truly Unruly with Marcus and Jessica Trufant. We are back once again. What up? It's Kel, Truly Unruly with Marcus and Jessica Trufant. And today we have a very, very, very special guest. She is a cardiac clinical nurse specialist, a family nurse practitioner with over 23 years of healthcare experience. When she is not saving lives, she is on TV as a health expert. She is a contributor to NBC Los Angeles. She's been featured on Dr. Oz, The Doctors, Dr. Drew, CNN, HLN, TV One, the BBC. She has the popular podcast Ask Nurse Alice, presented by nurse.org, that just recently hit top 10 on Apple Podcasts in the medical category. Ladies and gentlemen, our in-house nurse, Alice Benjamin.
Oh, thank you so much for having me. How much do I owe you for that introduction? Wow, that was beautiful.
I know. I'm like,
a green handshake,
how do we follow that?
I'm gonna have to Venmo you after this.
I got hey, for sure. No, so today, you guys, I wanted to really discuss about COVID and just Black health in general. There's just been a lot going on, especially in the last 2 years with the COVID pandemic and just Black health in general. And just having someone like you on, Alice, an expert, can help us debunk a lot of the BS that we're hearing and seeing on social media, a lot of the fear-mongering.
Yes, a lot of misinformation.
Right, tons of disinformation. So my first question is, what kind of people are you seeing in the ICU? Because we were kind of talking about this before. Now, are you seeing vax people or unvaccinated people?
So when you're talking about COVID, as far as the patients that we're seeing admitted in the hospital that are making it to the ICU, ventilated, a majority of those are unvaccinated people. I would say about 95% of them unvaccinated. And recently, as the pandemic continues, we are starting to see some breakthrough infections of people who are fully vaccinated, who are starting to get ill. So I know we'll talk about it a little bit later, but that's where the conversations of boosters has come up in the news here and there. So, but to answer your question, it's mostly the unvaccinated people that we're seeing with COVID in the ICUs.
Okay.
All right. Interesting. I'm not surprised. Are you guys surprised? I'm not shocked, right?
No. Especially with the new variant, right?
Yes, there's actually a lot to be said about. We're always hearing that there's a new variant. Every day
right,
seems
the
like
Delta.
there's a new variant. Right. The one that's most prevalent, it's responsible for about 98% of cases in the United States, is the Delta strain. It's the fittest, the fastest, the most virulent strain of all of them, even from the original OG strain. And so that's another reason why we want people to get vaccinated, because the more that the COVID virus has to spread, the coronavirus has to spread, the more likely it's going to mutate. So with every chance it spreads, it has the ability to mutate. And even so, there's even a newer strain, the Mu strain, that we're starting to see. And we're getting a little concerned about that, because it's showing that it's kin to the Delta, but has other changes that are concerning to us. I know.
Okay. So with each variant, does it get a little bit stronger?
Yes, this is like the newer generation of strains. So it's the Mu strain is something. It's almost like a combination of the Delta strain and the UK strain that we were worried about before Delta. So this is looking like a combination of both of those, plus with some other changes. It's showing that it looks like it's more infectious than the Delta strain. So it's not as prevalent yet, but we hope it doesn't get there. But we're on the lookout, just because it has those similar features.
Now, is the Mu variant, I've heard that's like been running rampant in like South America, right?
Yes. So it's like Colombia, South America, those areas. And so now it's here in the United States. It is. It's in all states except Nebraska. I don't know why Nebraska has been able to, evade this, but it's not there yet. And about half of all of the new cases are focused here in California, and half of those are in Los Angeles County. So, and I'm in Los Angeles, so we're really keeping an eye on it, hoping it doesn't do too much damage. But nevertheless, we don't like seeing any new strains populate like that.
Right. The strain not being in Nebraska, you kind of forget that Nebraska is even state.
Wow. Shout out to those born and raised in Nebraska.
I'm like, Nebraska? Who
Right.
is in Nebraska?
I got a quick question, though. I know I want to kind of step out and just say, so with all these new variants, you got the OG, you got the Mu, I think is what you said it was called, but it sounds like this is just something that we have to get through. And once everybody's vaccinated, it's almost okay for everybody to get, because it sounds like it's just going to keep going, right? It just keeps going and it's going to be normal, right? Or at least that's what we hope.
Right. The goal was to eradicate COVID-19 and the coronavirus, this particular pandemic. We wanted to eradicate it, but it's looking like, because we're not getting to herd immunity, we only have, I think it's about 75% of the United States has had at least one vaccine, and about 53% are fully vaccinated. We're not there yet. And so until we can get more people vaccinated, we're going to be dealing with it spreading and new variants coming along. So until we can get more people, we anticipate or suspect that we'll see future strains. And it's going to take us a minute to get to herd immunity, especially since, we're rolling it out to children. Now 12 and up can get it, but we still have those 12 and under. So that's about 43 million kids in the United States who aren't eligible. So, we got a long ways to go, but it's important that anybody who is able to get it should get the vaccine.
Speaking of kids under the age of 12, is there a potential vaccine coming out soon? I heard something, we're always hearing stuff.
I know we're hearing a lot of stuff, and to answer your question, yes. So they're actually doing clinical trials right now for children 5 through 11. And there have been healthy kids and their families who have volunteered to participate. And what they're looking for right now is what is the least amount of vaccine that these children need, and how far spaced does it need to be, and is it still 2 doses or is it an additional dose? So they're trying to sort that through, but we anticipate that there should be a vaccine for 5 through 11 by the top of the year.
Okay.
Yeah.
Okay.
Ooh.
And even younger there, and after that, that's when it'll be under 5 through up 6 months of age. That'll be the next group that they look at as far as getting vaccines. But, we need people to want to volunteer and be healthy children, families to volunteer to participate in these things. So it might take us, if it takes us a little bit longer, it's because people aren't volunteering to participate.
So how do you go out looking for volunteers? Are there like families that are just like, me, I volunteer my child? How does that work?
I'm not as well. Let me say this. So with the adults, we had no problem, hands down. More people volunteered to be a part of these studies. For Pfizer, they had like 43,000 people in their original study. Moderna had 30,000. Johnson & Johnson had 44,000 people just volunteering, like, me, I want to do it. And so, because at that time, remember, everybody was dying left and right, hospital morgues full. So everybody wanted an opportunity to live, and they're like, I need to get in this study so I can get this vaccine. Now, when it comes to children, not as many volunteers, but there are still people who are volunteering, and actually children wanting to be a part of this. Those are, I tip my hat to those kids, but there are definitely people who are still volunteering. And so, I've had that question asked a lot. Nurse Alice, would you volunteer? Would you let your children volunteer and participate in a trial? It's interesting because I'm not in that boat. My kids are all vaccinated now, right? Okay. So they're all 12 and up. So I'm not in that boat. But I would say that's probably a hard question for some parents, especially when, we're all concerned about our kids. We know that they're growing, they're developing, and we want to think long game, and we don't quite have a long-term studies yet. But for the most part, we have to understand that in these trials, they're giving very low doses trying to figure out. And we know that it's working for adults. They're lessening the amount for kids. So I think in today's society, knowing everything that I know, I would talk to my child about it and see if they wanted to participate. And if they were really wanting to, then I would probably let them participate.
Right. Marcus, would you volunteer our kids or ask them to participate?
Very tough question in the beginning. Probably not.
Hard no.
I think we're all, susceptible to the conspiracies and the theories and the fear and all that kind of stuff. That's why we didn't do the kids right away. You got to have a lot of
trust in order to do it in the first place.
We were kind of like, but then we were like, all right, now it's time to get with the program and make it happen. So now
let's sign our kids up.
I would do it. I would do it now.
Right. Well, kids are 25% of all new positive COVID cases. Although kids before in the pandemic, we were like, oh, kids don't get sick. Kids don't test positive. They're so resilient. But we're actually seeing a bump in cases, a rise in cases. So more testing positive. 1 out of 3 that get hospitalized end up in the ICU. So when they do get sick, they get really sick.
That's tough.
So it is tough. It's really tough to deal with.
That is sad. So people get vaccinated. My God. I just
staying on the topic of children. Alice, how do you feel about pregnant women getting vaccinated? Because I've heard so many like weird, like, obviously it's like people that aren't educated enough to even like, like make claims, but like, what is your thoughts on pregnant women getting vaccinated?
Right. And so let me preface this by saying, even as a health expert with, years and years of experience, when the vaccine first came out, I too was hesitant. I'm just going to be very clear. And part of this is because I didn't know much about it. I hadn't read all the studies. I wasn't as familiar. But once I've read through it, digested it, and really have an idea of how this disease process, these vaccines work and all of those things, one thing I will say is that with pregnant women, it was always talk to your healthcare provider first. But we now know, and according to the, what are they called? The American College of Obstetricians and Gynecologists and the CDC, based on all of the information that we know now, they recommend that pregnant women get the COVID vaccine. Being pregnant actually is a comorbidity, and you can potentially have more severe illness if you get COVID while you're pregnant. So we want to protect mom, we want to protect baby. So it's recommended that women who want to get pregnant, women who are pregnant, and those who are breastfeeding actually get the vaccine, because not only do you protect mom, but baby gets to benefit from all the antibodies that mom develops.
Okay.
Yeah.
So when baby's born, they have like instant antibodies that they wouldn't otherwise get because there's no vaccine for them.
Right.
Got it.
So it's a real benefit for pregnant moms to get the vaccine to protect their kids. And I'll say this, kids, their immune systems, they're not fully developed until about age 8 or 9 years old. So, I mean, think of how susceptible kids are. And I don't know about you, but my kids were always sick. Runny nose, boogers. It seemed like they always had something because their immune system is still developing. So it's not till 8 or 9 years old. So if mom gets the vaccine, baby has one less thing to worry about because they'll benefit from the antibodies that mom had.
Okay, so that deadens the rumor about vaccines causing miscarriages or kids born with extra limbs. I've heard that before.
Extra limbs? Are you serious?
Yes, I'm not kidding.
I didn't hear that one.
Oh, I've heard it.
Whoa.
A couple times. And I'm like, that doesn't.
And I would say that nothing's 100%. So there could be some stuff, but that doesn't mean that the vaccine is bad.
Right.
If people get sick from the flu shot, if people get sick from anything, right? Could even die from it.
Right.
But that doesn't mean that the overall thing is bad.
Right. And in the information, before they made this recommendation for pregnant women, they looked at the rate of miscarriages. It was anywhere from like 12 to 16% of women before COVID, before the vaccine. That was the rate of miscarriages between that. And so they looked at women who got pregnant, who knowingly and unknowingly got pregnant while receiving the vaccine, and they didn't have any increase in any miscarriages. There were no increase in birth defects compared to before COVID, before the vaccine. So with that, they made the recommendation that, and they said that, there doesn't appear to be any harm or increased risk to baby or mom. Let's go ahead and get them vaccinated.
Thank you for that. Because I don't know. I don't understand why everybody's just looking to go against the grain.
You know what I think?
Research.
You know what I think it is, Jess, is because if you've just like watched the trend of just human behavior in society, whenever something is a big hot topic, right? If it has something to do with people's health, finances, or whatever, and it's like, let's say like when the housing market crashed, right? And that was a big deal. And everybody at that point was an expert on real estate and was like, well, you should do this, you should do that. Every time I've noticed there's a big hot button topic in America, everyone all of a sudden becomes an expert because of things like social media. So people have a soapbox to stand up on. You know what I'm saying?
Yep.
And it's like when you jump down the YouTube rabbit hole and you believe everything you watch on YouTube videos, but you have like, it's this uninterrupted experience. So you don't have anyone like fact checking anything. So you just believe it because it sounds good.
Right.
I think that's where, personally, that's where I think a lot of that comes from.
I think like people like attention.
It goes in one ear and comes out the other.
People love attention, and if something is hot, if people want to be on the other side of it, if people want to be associated with it, people want to make money from it. Everybody got to hustle, right? So that's a big part of it too. And with social media, everybody can get that hustle out. Everybody got a voice now. So
Speaking of social media, Alice, we were just talking about this before we started recording about, I don't know if you guys saw the tweet that Nicki Minaj put out about how she didn't want to go to the Met Gala because they required people to be vaccinated. And then I don't want to misquote, but she had said something about like swollen testicles, like the vaccine is causing people's balls to swell up.
See, it's people like her with a huge platform that are the problem. What?
Right.
Yeah. So she's identified that she's not vaccinated. That's why she didn't go to the Met Gala. But she had referenced, I think it was a friend's cousin who is vaccinated, had swollen testicles, became impotent, and was just weeks away from getting married. And then his fiance left him. Wow. Now, in that context, it sounds like something else was happening. I don't have enough information.
It suddenly became impotent. Now, how did they know that?
That sounds like the mumps to me. People still get the mumps, Alice?
Mumps and rubella? Right.
The mumps drop down into his ball sack or something? That sounds like the mumps.
That sounds like a lot of stuff going on.
That sounds like something other than vaccine.
Might have got a swift kick to the nuts, and then you're having some issues, something like that.
Right. Well,
maybe not.
No. Oh, man.
And maybe he just didn't want to participate, he just maybe he didn't want to have sex and said it's not working. I don't know what he said. That was his way out. That's and again, I'm speculating, but that is not a side effect of a COVID vaccine. If anything, getting COVID because of the massive inflammation, especially in our blood vessels, which can also impact the blood vessels in the penis. If you get COVID, you are at an increased risk for erectile dysfunction and those type of issues. So not the vaccine. So if anything, you want to get the vaccine to prevent these type of things. So, I think this was a case, and Nicki Minaj, she said this too. She said she wanted to do more research. And based on the story she told, she hadn't done much to even share that story. So I'm not, now a lot of people came for her because they were like, research, you're not Dr. Fauci. What are you going to do? Go into the lab? I felt like she was using that word to say, I need to read up on it more. And I get it. She's a busy rap artist, has a new baby, but she needs to sit down and really digest the facts because the science is very clear. I don't know where she's been the last 19, 20 months, but the science is pretty clear. Getting a COVID vaccine is going to, is going to increase your chances of survival when it comes to COVID. And there's nothing that says, there's no research or evidence that suggests that getting a COVID vaccine leads to any fertility issues or leads to impotence or decrease in sexual desire or appetite. There's nothing about that for the vaccine. But if you get COVID, there are some studies here and there that suggest that those might be possible outcomes. So
they should be screaming that from the mountaintops, and you would get a lot of men coming in to get the vaccine,
man.
and a lot of women encouraging their men to go get the vaccine.
Right.
Yeah. It's all about marketing.
We don't
And
want
you
no
put that
erectile
commercial out,
dysfunction over here.
the guy with the sad face.
Yeah.
We might be good. But
we wish that person well, though. Whoever she was referencing.
right, yeah, absolutely.
Well, but he might need something else.
I know we're making light of this, but
a different shot.
I mean,
she just made herself just sound so uneducated, though. I'm low key embarrassed for her.
Balls and swell.
Yeah.
How is the virus, Alice? Because like we said before, like you're in LA, you're in the hospitals, you're boots on the ground, like you're seeing everything that's going on from beginning up until now. How is it affecting people of color? Is it affecting people of color differently?
It's affecting people of color worse. So we know that Black and brown people are 3 to 4 times more likely to experience severe complications from the virus. And there's a lot of reasons. Basically whole systemic racism, everything from not having health insurance, mistrust with the healthcare community, not going to your doctor or your nurse practitioner, not staying up on your health, to, so many different things contribute to that. But I would have to say, I think what I have seen in the discussions I've had with people is just lack of trust. And, people will reference the Tuskegee study from, how many years back. But it's not even just that. It's sometimes their most recent experiences with their healthcare providers. They didn't like it. They felt like that they weren't heard, that they weren't treated properly. They didn't get the right treatment. And I'm just going to say this, there's research and science to show that Black and brown people don't always get the same type of care as our white counterparts, even if they have the same amount of insurance, even if they have money, even if they have, they're educated. That still happens. So there is still racism that happens in healthcare. We see it on the news, we see it on TV, we see it in our communities. And for some reason, I hope people don't think that it just jumps over healthcare like healthcare is perfect. It's not. So, I'm in there all the time and I'm like, what's going on over here? But I'm not at work every day. So there's not a bunch of Alice's policing to make sure that the brown and Black people are, getting the care that they need. But we do need more Black and brown healthcare professionals, who can, because at the end of the day, it has a lot to do with that. Because I can say things and I can relate to Black and brown patients that, Dr. Stevens, who's white, he just can't. He can't talk about.
That's a fact. Right.
It's just got to be culturally sensitive and all that kind of stuff. And that is lacking.
It is.
I mean, I think that kind of goes for anything. It's like you're going to trust somebody that looks more like yourself, right?
Right.
Especially when it comes to, your health. I mean, it's like going to a therapist. Like my therapist is Black. I don't know if I could talk the same way to my Black therapist that I could talk to a white therapist.
Right.
Right. And I'll initiate the conversation. I'm like, Mr. Jones, what's going on here? I see this. I see this cigarette in your pocket. What's going on? You still smoking? Like, I can just have conversations about traditional foods or things that happen in the Black families. I can have those conversations because I know what it's like without being offensive. And sometimes people don't feel like they can be honest with, white doctors or white nurse practitioners because they feel like they're going to be judged or just, stereotyped and just, just written off. And sometimes that does happen. I can't say that it doesn't. So when people are hesitant because of mistrust, it's a real thing. I can't even say that.
Yeah.
Right.
Yeah.
It's like Black women that have babies. They have a high probability of dying because the doctors don't listen to what they're saying. They're saying something's wrong and they're just kind of dismissing what they're saying and they're ending up dying.
Absolutely. They are dying. There's the Kira story. And then even Serena Williams.
Serena Williams.
So Kira actually died because they weren't listening to her complaints of pain and, her symptoms. And it wasn't until it was too late they took her back to the OR and realized she was bleeding inside. Serena Williams, rich, powerful, has lots of money, all of these things. And they still weren't listening to Serena, but Serena took charge. She's like, hey, I am going. I don't care what you say. I've had a pulmonary embolism before. I know what this is. And sure enough, then that happened. But, Serena is a very powerful woman. Like she can buy the hospital, okay?
Exactly.
I don't know that other Black and brown women would feel that confident to say that, you know.
Right.
So because of that, we have Black women and Black babies dying at higher rates. So no woman should die giving childbirth, but it happens at an exponential rate in Black women. Yeah. Mm-hmm.
I guess the question is for me, and so what do we do, or is there anything that we can do for that? I guess when it comes to COVID, I'm talking about.
It's the
getting
entire system.
People to trust. I know that, of course, it's a bigger issue, but can we break it into small pieces to get people over the hump to get through this, though? Because like I said earlier, it's just going to be something that's going to go round and round and round.
Right. I think people like us need to get out in the community and encourage people to go get vaccinated and say, hey, we're vaccinated. It's okay. Point them to where they can get vaccinated, because I'm sure, well, I'm not sure, but I'm assuming that there's not a lot of places for Black people to get vaccinated in certain areas, right? They don't have access.
Right.
You know, or they don't know.
I agree. Yeah.
So
I would agree with that.
I think it takes people like us to get out there and say, hey, it's okay.
It is. So I love the fact that people like you with your platform get out there and encourage people to get vaccinated. And I also encourage, find someone, like bring me along or bring another doctor along also to answer those hard questions. Because there's going to be somebody that's going to ask a hard question and say, well, you're not a doctor, you're not a nurse. Well, okay, well, you know what? Here she is. Here he is to answer all those questions. Yeah. So I think that would be a great duo. And then I also have to say some of these vaccine sites need to stop being bankers' hours, because my people are working long hours. They can't take off of work. They don't have PTO. They don't have a babysitter. So we also need to think of how do we make this more accessible to people? And to me, that's including maybe giving vaccines in the evening hours. Because I don't know if you guys noticed, or at least in my area, after 5 o'clock, nobody's giving vaccines. Well, what if, I don't get off until 5 o'clock. Then I got to go pick up my kids and then I can go get the vaccine. So that and weekends. So let's make it more accessible. Let's get it, maybe we do one, at the church. We have to look at who do we trust, right? Let's look to those leaders, those organizations, and let's partner up with them to get the message out. So, get people, first one, get them educated, informed, and comfortable, because I think that's a lot of where the hesitancy lies. They feel like, oh, why are you rushing me? Hold on, let me ask my questions. And so I'm like, okay, what you got for me? Go ahead, let's go.
That's a good point, Alice, because that's actually one thing that they did down here in Vegas. So there's this pretty popular Black barbershop that I guess the whole shop had gotten COVID and everybody got really, really sick. And the owner was like, F this. And he made it on the weekends a place for people to come and get vaccinated.
Wow.
So it was like a vaccination center. So you come to the barbershop, you can get your vaccine.
You get lined up and get a vaccine. Wow.
Right.
You can get your vaccine.
It's organic, you're comfortable. It works.
Yeah. And so they did that. I think I want to say actually quite a few barbershops actually did that down here in Vegas. But there's a couple of folks that are kind of starting to get hip to that. But no, I absolutely agree. Like there should just set up centers, in the church or the community center or something like that, just for folks to go and
even at the job too. At these places of business, they should be given the vaccine too.
Because they'll give you the flu shot at work. Yeah. My old job at the radio station. Oh yeah, when I used to work at the radio station, then people would come in and say, "Hey, come into the break area if you want to get your flu shot."
Yep.
Just like that.
So I don't see why they can't. Especially if Biden's making it so if you are a company that has over 100 employees, everyone needs to be required to be vaccinated. Just have them come to the job.
I think we're going to start.
Then you got your liability and all that kind of stuff too. Businesses can be funny like that.
Yeah. So, no, that's true.
I don't know.
I think there's a way to partner. We just need to be strategic about our partnerships. But I believe that we'll start to see more of that happen, because his plan is to get more people vaccinated and then realize we have boosters that are going to be coming down the pipeline. So how are we going to get people boosters as they're going back to work? Remember, everybody was home. right? Most people were at home.
Yes.
So, okay, we could go get vaccinated. We weren't going nowhere, but to the vaccine site. Now we're back at work. We're back at school. We're doing so many things, and we want the economy to be open. We want to be doing these things, but I'm pretty sure they're going to find creative ways to get, more of these vaccines out and these boosters once those become available.
Mm-hmm. Now, how long are you immune after recovering from COVID? And do COVID survivors need a vaccine like immediately, or do they have this natural immunity, quote unquote?
So good question. So based on what we know now, we know that the vaccines provide pretty long, what we believe to be long-term protection against severe illness when it comes to COVID. Now, let me just say this. So when the vaccines came out, remember Pfizer was saying 95 and Moderna like 94.1% effective, right? So people thought that, I have a very small chance of getting COVID. But the thing was, these vaccines were never 100% at preventing you from testing positive. It was just really to prevent severe illness. So, these vaccines are pretty good at this, but over time we're learning that they're starting to wane. So once you get the vaccine, they're saying about anywhere from 6 to 12 months, some of the immunity starts to wane. So you're not going to get sick. Remember, you're protected from severe illness, but you might test positive. So that's between 6 to 12 months. So that's why now they're saying that, at 8 months, we project that at 8 months, that's when someone should get a booster vaccine. Now, for those people who have tested positive and had COVID, they have natural immunity. I'll say they do have some immunity. That's true. But we just don't have a really great way to measure that, to see how robust it is or how long it will last. So we still recommend that people who've tested positive for COVID and have recovered from their illness, once they've recovered from their illness and they're asymptomatic, you can go ahead right away and get your COVID vaccine. We used to tell them to wait, but that was when we were in a shortage. That was just because we didn't have enough vaccines out there. But now, once you've fully recovered, go ahead and get your COVID vaccine.
Okay.
Lots of facts today, man. This is heavy.
This is good.
Yeah.
Good.
And then Alice, because like I said, you're an expert at this. How do us regular folks, how should we be taking in our information since there's so much misinformation? How do I separate the disinformation from the real information? Because I feel like that is one of the big reasons why, people freak out and they don't want to get the vaccine. Because, I hear folks say stupid shit like, oh, this is like Hitler and the Jews wearing a star. I have to have a COVID vaccine card. I feel like I'm a Jewish person during World War II, and I'm like, how can you compare this to the Holocaust? Like that, you can't even, like, that's disrespectful to every person that's died in the Holocaust and Holocaust survivors. That's like me saying this is comparing it to slavery. Like, you just can't compare the two things.
No,
like, you know what I'm saying? So like, how do we help the people that are freaking out because there's just so much disinformation?
Right. So, gosh, where to even start with that? Because there's a lot.
I know that's a loaded question. I'm sorry.
There's a lot of misinformation on social media, because this is the thing. People who are good at spreading messages on social media, not necessarily health experts that know all the details. And all the health experts that know all this information aren't really good on social media. So it's like a total disconnect. So so what we recommend is, for one, talk to your healthcare provider, right? Talk to your doctor or your nurse practitioner. The thing is, but I have to be mindful. Not everybody has a doctor. Or if you have one, maybe you got insurance, but you ain't seen one in forever. So who do you go to? Where do you go? So, go to the CDC website and go to your public health department in your local area, because it's going to be very important. And the reason why I said in your area, because what's happening in Los Angeles might be different than what's happening in Miami or Atlanta. And, the rates might be high here, low here, and how they're going to distribute their vaccines are all differently. But definitely go to the CDC website. Definitely go to your local public health department to get information. Those are two of the best places to go to for information outside of your healthcare provider, should you have one. And I just want to throw this out there, because we know, just like there's always somebody crazy in everybody's family, there are a small amount of healthcare professionals out there who are also touting incorrect information. And
Oh, no.
Oh, yeah,
right.
there is.
So the medical boards, the American Medical Association has, they have put out some guidelines saying that, listen, if you are a physician and we find out that you are touting out misinformation, disinformation, or ordering like ivermectin or those type of things on your patients, things are not FDA approved, you will be sanctioned. So that could mean leading to a suspension in your license or your license being taken away. So
Good.
we imagine that's going to be happening for nurses as well. I mean, that's another thing to do, but I'm hopeful that most physicians and most nurses do the right thing. But, you know, we're human too. So there's going to be just like there are some people who don't, you know, like the Nicki Minaj's of the world. There's some of those that are doctors and nurses. So just be very careful. And if somebody's going to tell you something about a side effect, ask them, well, where did you get that from? You know, make sure you can go to that site and then look at that site to see if it's really reputable information. That's another thing. It's like the Bible. I don't know. Sorry. It's like, you know, a preacher can tell you all of these things, but not until you actually have a Bible in your hand or you've read the scripture, you know, that's when you really know what it says. So I want people to really know where to go for information.
Right. And even a step further, there's some preachers that are crazy. And you talk about doctors being human, right? Some preachers are way, you know, out, right? They're up there in the stars. So you got to do your research and you got to kind of use your gut, but you got to search for the information.
I know
now with COVID, there's so much information that's coming. There's something new every month, every week or whatever. So it's tough to keep up with.
Right. It's hard to decipher.
Yeah.
It's like,
it's tough. It's tough.
Well, it doesn't help either when you have doctors who are like, people will be like, well, this doctor said this, and that. And I'm like, well, what kind of doctor is he? Well, he's a foot doctor. What the hell does the foot doctor know about COVID?
Right.
You know what I'm saying? Like, what is a hair transplant doctor about to tell me about COVID?
Right.
You know, just because this cat's a doctor, don't mean he is an expert or, you know what I'm saying?
Bring your hairline back, though. He can bring your hairline back, but
he can bring your hairline back, but he can't bring you back from that.
Yeah.
You look
so
hair would look really nice in that casket, but I don't know what else.
Wow. Yep. That's heavy.
Yeah.
That is heavy. Right.
And just to move away from COVID for a second, we have a lot of our listeners, Alice. A lot of them are in between the ages of like 35 and like 55. And I know, especially in the Black community, that's a time where Black folks should definitely start getting checked up on certain kind of things. So what are some things that some just advice for folks that are listening that, you know, are turning that corner in life and have to really start paying attention to, you know, certain health things like colonoscopies and stuff like that. Like what are some things that Black folks or just people in color in general should be paying more attention to?
The first thing I want to say is just go to, even if you haven't been in years, make an appointment to get a physical assessment, just a baseline physical, see where everything's at. Because, you know, I can tell you about diabetes and high blood pressure, but we need to know where you stand, where you are. So, you know, what is your blood pressures? So, you know, please at least get a physical. Let's find out where you are, where your numbers are. And when I say numbers, I'm talking about like your blood pressure, your glucose level for your diabetes, your cholesterol level. And then also when you go and get that physical, it's not just they're going to listen, look, and feel on you, but they're going to ask you questions about your family history, any how you're feeling, you know, any aches or pains, does anything bother you? Because when you can tell the story about how you feel, and we learn, oh, you know, grandma had breast cancer, my aunt had breast cancer, and then, you know, my sister had breast cancer, then you know what? I'm going to need you to go for a mammogram and maybe go sooner than what we normally have people go for. But so, you know, so there are kind of age guidelines for certain things, but it's important for people to understand that if you are having some type of symptom, let's say something's bothering you, it's swelling, it looks like the skin, there's moles on your skin that just grew over the last couple months that are bothering you, like anything that's happening to you, it's important for us to know that because that's going to dictate us maybe sending you to get screened sooner. So let's take colonoscopies. Colonoscopies were originally recommended at the age of 50. Now it's been recommended at the age of 45. And that's for anybody, 45. Now just imagine if you had family history, you may need to go sooner. Or, you
At
might
40.
be having some, you might need to go earlier, or you're having some tummy pains, or when you're having pains happening, it's like, okay, well, let's send you for a colonoscopy, because we know that Black men, we're seeing a lot of younger and younger Black men, Black people, period, having colon cancer. We are. I mean, if we look at Chadwick Boseman, how old was he? He was
young.
He wasn't that old.
No, he wasn't.
I think he was young 40 or what?
Yes. He was definitely right, but he definitely wasn't 45, which would have been, when we tell everyone else to get a colonoscopy. He was already
He was 43.
Okay, but he was already at an advanced stage of cancer. So the important thing is, if you get in, tell us how you're feeling, tell us about your family history. We can get you screened to find out where you are, and hopefully, if we do see something, get it treated on its early stages before it becomes an issue. That's the thing. We don't want things to become an issue. So if, let's say, you're maybe someone, in the shower when you're washing yourself, women will say, I felt this lump in my breast when I was taking a shower. Okay, let us know, because now we're going to send you for a mammogram and an ultrasound. Oh, it looks like there might be something there. We take a look. Oh, it looks like precancerous cells. We'll be able to take that out before it becomes an issue. Where if you leave it there, it goes undetected, it can spread. It can, and by the time it really becomes a problem for you, it's advanced breast cancer. So we want to prevent things like that.
Yes. I hope everyone is listening.
Yes. And do you think, Alice, that the younger generations are becoming better at, doing these kind of checkups and going to the doctor? Because I just remember, let's say my grandparents' generation. Like, my grandpa used to hate to go to the doctor. And it was always, well, I'm fine. I'm not sick. I don't need to go to the doctor. Do you think people are getting better at that now?
Well, okay. So I'll say yes, but kind of no. Yes, because these younger generations are so into self-care, and it's all about them. Everything revolves around revolves around
selfish.
I don't feel like it.
I don't know if that's a good thing, I guess.
But so they're so into self-care, eating more organically and other things like that. And this may not apply to every single person, but it just seems like that's been the theme. They're bigger and more open to talk about mental health than someone in my age. And I'm not old or anything, but I'm just saying, for the 40 through 50s, a little taboo. We don't like to talk about it
still.
So, but these younger kids, they're more open to going to a therapist, but, so they're open to the idea, but then sometimes healthcare is still a business. There's still a cost to it. You still got to have insurance. So sometimes that can still be the barrier. There are a lot, nobody wants to be sick. Everybody wants to be healthy. It's just usually a barrier for them to achieve that. So whether it's, they can't get off of work to do it, they don't have insurance, there's usually a barrier. So, but I think people are more open to it, and especially with social media now, because we can do a lot of bite-sized fun education pieces online. So hopefully the messages are getting out there more often, because, they do little TikTok dances, and then the words are like colonoscopy, 45.
Right. Man, a lot of the information's at your fingertips too, because I know that we
have pagers.
Google everything. Yeah. The kids are sick, or I'm not feeling good. Let me Google it and see exactly what this is.
I mean, that's good, and it's not
it's
good.
a gift and a curse.
Right, it's a gift and a curse.
That's usually, I'm gonna say, Marcus, that's usually the scary shit though, because usually when you Google it, you get
it's cancer immediately.
Worst, severe version of it. You're like, oh my God, is that happening to me?
Yeah, that's true.
Yeah. So in those cases, make sure you go to a hospital website of information versus just what's on Reddit. I'm not sure.
Exactly.
That's what
right.
Exactly.
Dang, I've gotten some good advice from Reddit.
Or have you?
I know. No.
Right.
Everyone that's listening, Alice has pretty much said it herself. It's better to prevent than try to cure it and wait too late. So get your checkup. Right. You guys got any more questions for Alice? This was a great episode.
Yeah, this is Excellent episode.
This was.
Do we want to?
And it was free. No copay. No copays for this.
Free game. I'll take it. I will take it.
Message after message after message.
I'll take it. Hey, you got anything, Mama? Any questions?
No. I think Nurse Alice answered a lot of questions.
People really need to tune in for this episode.
And listen.
This is good. Get to the facts.
Right.
Get down
and
to
got
the
to the bottom of all the rumors.
Spiel.
Right.
Yeah.
So.
Well, shoot. Alice, thank you so much for joining us. Everybody, Alice Benjamin, she is a cardiac clinical nurse specialist, family nurse practitioner. Like I said in the beginning, over 23 years of experience. You can catch her as a contributor on NBC Los Angeles. Also, check out her podcast, Ask Nurse Alice. That is on all streaming platforms, and it is an amazing podcast, and it is full of really, really good gems and information, not just for people that may work in the health field, but just curious minds. So Alice, once again, thank you so much for your time, for joining us, and we appreciate it so much.
Thank you for having me.
Thank you for what you're doing now and what you do all the time. Thank you.
Thank you so much for having me.
Yes. My name is Kel, Marcus Trufant, Jessica Trufant. Of course, follow us on social media, truly unruly _podcast. Oh yes, Alice, what is your Instagram hold? Is it just Nurse Alice?
I am Ask Nurse Alice on all social media platforms. I make it easy for people.
There you go.
Boom.
Mm-hmm.
Give Alice a follow. She definitely drops gems on her IG. Follow Jessica _Trufant, Marcus _Trufant. I'm Media Kells on IG. You can listen and watch us on all streaming platforms. If you want the visual, subscribe to Marcus Trufant on YouTube. Watch us every Sunday night on the Converge network. And I think that's it, guys.
I think you got it, bro. I think that's
got it all.
Yeah, that's it.
All right. Till next time, everybody. Peace and love.